Welcome and good morning or good afternoon to everyone. Welcome to our Costa Resilience Talks. This is part of our webinar series organized by DCC-CR together with the CMCC Foundation and Deltares. Thank you for joining us today. This series brings us together once a month, usually on a Tuesday toward the end of the month. We explore case studies, researches, and stories of resilient communities, along with real-world solutions to protect and restore ecosystems. The DCC-CR is a decade collaborative center under the United Nations Decade of Ocean Science. We focus specifically on Challenge 6, that is increasing community resilience to ocean and coastal risks. And we operate under the objective of achieving a safe ocean. We organize this series together with our partner Alliance Network through these QR codes. You can connect with us, and the contribution of our partner Alliance Network to this series reflects a broader effort of the PAN to bridge the gap between people and actionable science by promoting equitable education. Today's session is dedicated to the social determinants of community engagement in scientific and policy projects. For sure, we know that community engagement is essential for resilience. It helps ensure that science and policy are not only technically sound, but also inclusive, equitable, and also grounded in real life needs. And it's my great pleasure to introduce today's speaker, Pancho Argüelles. He's the Senior Director of the Praxis Project. He was born in Mexico City, and he has worked for human rights across the Americas for over 4 decades. He co-founded the FEE and Justicia Worker Center and led the Living Hope Wheelchair Association, and now continues his leadership at the Praxis Project. He holds degrees from UNAM and the University of Houston Clear Lake, and he has dedicated his career to advancing equity, justice, and the empowerment of marginalized people. And we are truly honored to have him with us today. Just a few technical information. This webinar is being recorded, and to address your answers to the speaker, please use the Q&A box that you find at the bottom of your screen. You can start asking your question during his presentation, and we will address them to him at the end of his speech. So thank you for being here again, and Pancho, the floor is yours. Sorry.
Thank you, Annalisa. Buenos días. Good morning, everyone, and thank you to the UN Decade Center and the CMCC and all the organizations who make this possible, for the invitation, and for all of you, the participants, for joining us. I wish we were able to see all your beautiful faces across the world, but I understand it's the format for webinars require us to do it this way. And like Annalisa said, I am Pancho Argüelles. Don't let my British accent fool you. I'm from Mexico City, and I live in Houston, Texas, which is a big coastal metropolitan area of the Gulf of Mexico. Yeah, we still call it that. And again, it's an honor to be here to share some of the learnings I have gotten through 40 years of experience working most of the time from the community organizing side of things, but at some points also through some research projects when I wasn't part of the research team, working to engage with community to produce or enact knowledge that helps people address the issues they're facing. And I come from a tradition of community work that in Latin America we call popular education. Was popularized by a Brazilian educator, Paulo Freire, in the 60s, 70s, 80s, but many people have written about it, still writing it and practicing it all over the world, in Africa, in Southeast Asia, in Latin America, as I say, many places. And that tradition is centered on the idea of opening spaces for dialogue, centering community and centering human dignity, with the notion that all human beings have knowledge and expertise because all human beings have experience. And all of us, we are experts in our own experience. So I always like to start the spaces where I train and work, doing something that will help us connect as humans. We, unfortunately, across the world, are constantly navigating and surviving in institutions and structures that were not created for us or by us, facing challenges, and to just be who we are in some cases, sometimes even taking risks to be able to just show up and be who we are. So we constantly navigate professional, educational, or just social spaces where our humanity is not fully included, respected, acknowledged. And so in my experience, one of the first things to do is to do exercises or things that help us connect with our humanity. So today we're gonna do that by taking a moment to connect at that level. And I'm just gonna start moving. I share my screen, a little thing about my organization, the Praxis Project, where I work. We work supporting grassroots groups and research organizations and advocacy groups to advance health equity, social, racial justice through technical assistance, capacity building, and accompaniment. Well, they already presented me, but with the exercise I want us to do is to take a moment to share who we are. Ideally, we will be in the same room looking at one another in each other's presence. That happens in these big events, or like the last assembly in Lecce at the beginning of this year, when I had the opportunity to meet some of you in person. But when working with community, we're working with groups. Sometimes I do this exercise when we ask people to go around the room and exchange our name, and instead of our last name, we just say our favorite food. Yes. So in my case, I will be called Pancho Black Beans. Yes. And this is hard because I usually looking at people's faces. So I don't know if any of you are smiling or you're rolling your eyes and thinking like, who is this guy and why we are not getting into it? But I'm going to ask you to take a moment and quickly go into the Zoom function of your in your computer and change your name. Your first name is your first name, and your last name will be your favorite food. Let's take a moment just to look at that for a second. And I'm going to stop sharing so I can look at the list of participants for a second, okay?
Just a quick note, in order to edit your name, you must click on the More button that is near to your name on the list of attendees.
Yeah, I hope people know how to, or in the question. And oh, the chat is disabled. Yeah, you don't do it in the chat, or you want to do it in the questions, you do it in the questions. Tatiana Ferrari say we cannot do it in the chat, but I don't know if you could do it on your own name, and not to take too. Oh, so you are not able, says Claude. So just do it in the question, maybe. Arriba says that she's Arriba Brownies. Annalisa is Annalisa Pizza. And if you want to just write in the questions, you can put, and for those who are just joining us, we are doing an exercise when you say your first name and then your last name is your favorite food. So we have Chiara Tamales, Andrea Sour Cream. Hey, hi, Andrea. And she's in Houston too, an amazing colleague and friend. Tatiana Eggplant, Verena Ice Cream, Nicola Mango, Deborah Fried Chicken, Aaron Pancake, Camila Tiramisu, Edwin Tortillas, you see, black beans and tortillas, now we're talking. Luciana Arepa, Takelo Bilton, Cristina Carbs, okay, and then we're ready to run. Eleonora and Tortilla de Maíz, Archie Gelato, Laura Apple, Edwin Tortillas, Sara Gelato. Cristina says this is hilarious. Thank you, but I still don't see her last name. But okay, Marvin Adobo, Alona Tacos. Okay, we're gonna cut there for a moment because we don't have a lot of time. But you see, little things like this. If we were in the same room, we will see that people will be smiling, laughing. And then we will make a little reflection on how something that you notice when doing this exercise. I will ask the group, what did you notice? People say, oh, it's very diverse. Whatever you put as your last name or your favorite food, in many cases, it speaks of your identity, your culture. If you are an immigrant or refugee, it speaks also what you're missing from home or what makes you feel home. It speaks of sometimes your mom and your family, where you grow up eating the food that speaks to your heart and makes you feel comfortable, happy. And that's powerful. Again, that is a humanizing thing in a society that constantly dehumanizes all of us, but particularly those who are in positions of marginalization or with less power. And then just to finish with this exercise, the last thing I will say is very important when doing work with communities, coalitions, and multiple stakeholders groups. Those meetings are like a potluck. And in the US, a potluck is a meeting, a gathering or a party where each person brings some food, different plates. You know, in Spanish, in Mexico, we call them fiestas de traje. Each person brings something. So you will, in a cooperative way, bring something and then you have the meal. Well, meetings are a little bit like those potlucks. The only thing you can be sure to find in a meeting is whatever you bring. So if I show up to a meeting with community members and stakeholders to talk about my research project that wants to become action or policy for coastal resiliency, the only thing I can be sure I'm going to find in that meeting is whatever I'm bringing. And that is why it's essential that I show up centering the values on why am I doing this job. To take a moment to ground myself on those values. That's why in the presentation, and we're going to share the presentation with you. We talk that any project at its heart is an ethical, political project. And we need to be intentional and clear about this. And then again, try to live those values and center showing up to places with deep respect, love of the communities we are working with, centered on our own dignity, but also really from there being open to their own dignity, to their own knowledge, and then engage in dialogue. All right. So I'm going to go back to sharing my screen. And Then, yeah, we're going to be going quickly over some of the working principles we use in Praxis when advancing health, justice, racial equity. Reflect a little bit on this notion of social determinants of community engagement, which I am taking on loan from the concept that the deeply developed literature and work on social determinants of health. And I want to make sure that to leave some time to reflect on your own experience, and then we will close. And then another thing that I usually do in my trainings is I introduce my advisor, Alejandro. He is the president of the Intergalactic Association for Human Rights. Given the way things are going, particularly in the United States, we are really worried about human rights. But jokes aside, I like to in some way bring that in the sense of the humor that helps, again, connect at the human level, but also reflect about alienation as a pre-existing condition of our efforts to engage in dialogue, to figure out action together for our goals. Again, in this case, is coastal resiliency, how to make our cities and environments more resilient to the emergency of climate change. And when by reflecting on alienation, we are reflecting on a philosophical concept that refers to the ways by which we get separated from our humanity. So doing things in our events that connect us to our humanity is an essential way of setting the common ground from where we are going to be engaging in respectful dialogue. Okay, going back to the framing of social determinants of health, there was a seminal article by Dr. Marmot from Great Britain reflecting or documenting some of these elements that have an impact on health outcomes. And in the field of public health, I don't know how many of you interact or are part of the public health world, you will find this frustrating tension and trend that I have been dealing with for a long time, in which there are frameworks that want to reduce public health or issues and health outcomes issues to individual behaviors and choices, which is a very typical kind of neoliberal positivist way to go about things. Simplify, take out the contradictions. But in the field of public health, that has consequences in terms of the solutions that are proposed. So for instance, we had a big initiative we were part of with Praxis about childhood obesity in the US. And you will see some institutions and groups coming with proposals that were all centered about individual behaviors, eat healthy, exercise, or the same with tobacco use. And then there was a discussion and analysis of the need to see how one thing is to propose that behavior, and then the other is to live in conditions in which those behaviors are actually not choices available to you or your community. Because if you live in an area that is poor and there is high unemployment, and there is no grocery stores nearby, but there is only small stores that sell a lot of unhealthy junk food, and then if you want to go play in the park, you're going to be harassed by the police, or maybe there is risk of crime, or the air quality is really bad. It's not going to be so easy for me to do all these healthy individual behaviors. So this reflection of social determinants of health takes into consideration all these other social, structural, and historical elements that generate, or have an impact on the kind of space we inhabit. No, and you can see there's mentioned so many things: access to marketing and retail environment, justice system, housing justice. Do I have access to affordable housing, which is now a crisis in many of the cities where you are living? Access to civic participation, community safety, economic justice. I have to add and put bigger here environmental justice, which I know is important to you all. And I want to call the attention also to this concept of hope and efficacy, which comes from the field of psychology, social psychology, psychology of education, the notion that in order to do something, we need to have a belief that we can do it, and that makes a lot easier to learn things, skills or concepts. And again, if you are part of communities who have been historically marginalized, see, if you have been socialized, receiving social messages that tell you that maybe just because of who you are, you might be a little less than those who make the rules or who are the reference for normality. Sometimes it's hard to actually believe that you can learn that you are subject of dialogue and rights, even if you know that you have dignity and you have rights. The actually possibility to engage with initiatives, there is an initial barrier that, okay, is this doable, possible? Is this for me? So doing the work to establish relationships that allow to connect to this notion of hope and self-efficacy, that we can do this, is essential. And it's done through dialogue, and it takes time. It goes well beyond one event, parachuting, dumping a lot of information and leaving, which is what I have seen happening many times on my side as a community organizer. No, like Annalisa shared that I was the director for 10 years of a local group here in Houston, formed by immigrants with spinal cord injuries, immigrants who got injured in the job or by car accidents or by crime and became paralyzed, paraplegic. They were on wheelchairs. And then there was a public policy decision in Harris County, which is where Houston is based, to deny these people access to healthcare services, like access to medical supplies, catheters, diapers, wheelchairs. So they had to come together and organize to survive together. And I work with that group and accompanying in organizing to get resources to start getting donated medical supplies and equipment to try to change policy. And sometimes we were approached by research institutions that wanted to collaborate with us. And we had some good experiences that were respectful and were about collaboration and in some ways even solidarity coming from the institution. But also sometimes we have not so good experiences in which our members, our community was just treated as an object of research, not a subject of rights and knowledge, but just an object of research. And the relationship was extractive. You get data and then go away and not make, and this is kind of the essential ways I put it, is one of the questions we need to ask is, when I approach a community, how I am making myself relevant to this community's needs and desires and interests, particularly if it's a marginalized community, how am I making myself relevant to the efforts that this community is doing to survive and to live with dignity? Because depending on how relevant me and my institution become to those efforts, is going to be the level of trust and engagement that we're going to get from that community. And yes, it might have an impact on how I relate to other sectors in that same society, because one of the things we need to acknowledge when we look at the social determinants of health is that there is competing agendas in the complex social spaces that we approach. And some of those agendas are complementary. Sometimes there is shared interest, but sometimes they are actually in opposition. So from our framework, we believe that it's essential to be clear about your ethical, political core values and how you position yourself in the space in a position of being an ally and being in solidarity with those groups who are the most marginalized, those who are facing suffering, those who are facing risk to their life and challenges to live with dignity. And that doesn't mean that we need to show up with a flag and revolutionary speeches and get into conflict with everybody. No, but it means that we can make choices on how we show up. And for this, in the framework from Praxis, we we have these elements which like principles, but also impact our methodology, which is we act with care. We look for to be intentionally inclusive. Again, for instance, working with people with disabilities. If we are not intentional on how we modify our approach, then we might be by accident excluding people. And that's where it connects with the notion of privilege that is mentioned in the title of the webinar. I learned working with marginalized groups, given the intersectional privilege that I carry as a human being. I'm a able-bodied, bilingual, male, heterosexual, college-educated person with immigration status. So that gives me possibilities to move around the society in Texas in ways in which a lot of the people in the community don't share. And that means that if I invite them to an event, or even better, if I invite them to a process where they can join and be part of a conversation to come up with policy ideas or to implement ideas to improve our lives, when I invite them to an event, they're going to be facing barriers that I don't face given my privilege. And this became very clear in working with the group I was the director of. I was working with immigrants with disabilities, which is called Living Hope Wheelchair Association. One day we had a meeting with a labor union to talk on how we were going to work together in a policy initiative to improve public transportation. And we came to the building of the union, and it's an old building, and suddenly we realized that they didn't have a ramp to go in or accessible bathrooms. So my brothers in the organization, my colleagues, they couldn't join the meeting, and we had to postpone it. And I was really embarrassed for not thinking of this in advance, for not asking in advance. And for me, that they became very clear that one definition of privilege is the things I can forget about. If I can forget to ask about a ramp, it's because I don't need one. If I can forget about interpretation to Spanish, it's because I'm bilingual. If I can forget about what is the last time a bus goes through there, is because I have my own car, and so on. No, if I can forget to ask where is the parking, is it well lit, is it dark, is because I am a male. I don't feel threatened by crime the same that sometimes women or a trans person or a gay person will feel threatened by being out there, just being who you are. And so this notion of inclusivity is connected to a critical thinking about the way difference gets sometimes penalized in current society. No, another of the principles is the notion of authentic collaboration. Again, how do we avoid an extractive relationship, no, or even more like a colonizing one, when I show up with an attitude that just says, I bring the knowledge, I know better, you just do as you are told, and follow, like there's a division of labor, you just follow the lead of those who know better. No, when that you get that message, you are like, okay, this is not for me. That I really don't have a place here to engage in a respectful way, so you don't engage. And I will come back to the notion of authentic collaboration, but then look for sustainable solutions, and then a commitment to transformation, right? Which is an acknowledgement that what the conditions that we are facing are not good for a lot of the people in society, for a lot of those partners that we are looking to engage with. So acknowledging that things are not right, and the fact that some people are struggling to eat or to have access to healthy foods or transportation or dignified housing or a job with a living wage or affordable healthcare, acknowledging that that's happening, but also acknowledging that that is not right. Establish a relationship that is, again, humanizing and collaboration. And that doesn't mean, by acknowledging, that doesn't mean that I have to resolve it all or lose the focus of my actual project, but it sets the ground for a different relationship by sharing a critical approach to things as they are. And again, if I acknowledge that, it might mean that some of the actors I'm trying to engage with might become more defensive if I'm interacting with elected officials that will like me believe that everything is perfect in that little community, or that if people are facing a problem like extreme poverty or homelessness is because of their individual behaviors and there's no responsibility from society or from the state, then we might have a different relationship. So yes, taking this approach might bring some challenges itself, or when engaging with the business sector, the big and small businesses, again, it might bring different challenges. Like when we were with the Worker Center that here in Houston, which was created to address the constant abuses that especially migrant workers will face in the workplace. Yes, sometimes that brought us to clash with business owners who were not paying salaries. They were not paying the salary to their workers. Their full salary, they were stealing the overtime, or sometimes they were just outright stealing the whole salary because they felt they could, because these were vulnerable migrant populations. But again, you also find allies. You find people who share the notion of building more just and democratic societies. So in some ways, part of what I'm saying is conflict and authentic community engagement are not separated. And conflict can be generative, can be a transformation of current situations for better ones. Oh, you see, I have special effects in my presentation because we all work around coastal resiliency and the ocean, so that's why all the blue theme and the water effect. Just a reminder again that be intentional about the ethical, political aspect of our work. Paulo Freire used to say, like, there is no neutrality. We operate in spaces in which there is imbalances of power, and we need to be intentional and clear about our ethical, political values. And that doesn't mean just a dichotomy of good guys and bad guys. It means that, again, there's articulations of power and values, and we can be intentional on those who bring us together to operate around something. Part of our framework, when we do reflection about the social determinants of health, another way to reflect on this is that you show up to a place and you see at the surface level, we see problems, needs, behaviors. No, and here I am doing a bilingual slides, which is another essential aspect for inclusion and community engagement. If you are working with multilingual communities, you're gonna need multilingual strategies, multilingual resources. So we show up, and another way again to reflect on the complexity of social determinants of community engagement, or anything you are working with, it has social determinants, is to go deeper, no? Like, so we go at the surface level, we see problem, needs, behaviors, we respond, many organizations, society in general, respond with services and trying to create opportunities like health services or housing services. Or if there's hunger, you respond with food banks or food soup kitchens, no? But then if you do a critical analysis, you go deeper and say how this problem was created. There you see that there are policies, no? Like the problem that created Living Whole, which was lack of access to catheters and diapers, was a policy decision to close the access to those medical supplies. The same way that in a estuary, if you are working and there is high levels of pollution in the estuary affecting the watershed, and there are policy decisions that allow, for instance, for deregulation of the companies or allow the establishment of some industry in an area, and that generated the problem, no? Like right now here in Southeast Texas, there are policy decisions being made that are allowing Elon Musk to establish big initiatives for his SpaceX companies that are having big environmental impact in all over the regions. And those are policy decisions that are not connected to power. No. So to policy decisions and public policy issues, we respond with policy campaigns. And that's a good thing. But then we do that in societies, and I know this is a global audience, so it's all very different. But we are living in a time in which the institutions of liberal democracies are in retreat in front of the forces of global capitalism. Yes, the function of the state is being challenged and controlled, and there has been all this huge push for deregulation, globalization of markets, but at the cost in many cases of the capacity of communities to have more saying in the conditions that affect their everyday lives, but also the national states are also facing challenges to enforce policies that affect the well-being of their whole populations. So we have campaigns for public policy in complex environments, and then we see that those campaigns sometimes are not enough because there are structures and systems that make hard to advance policies. No, we say we live in democracies. We do. There are democratic space, and at the same time, society has becoming less and less democratic. And in the case of the U.S., it's very clear that the moment that this society made a decision to allow big companies and billionaires to finance the electoral campaigns or elected officials, democracy took a big hit because the correlation between one person, one vote got really limited, and now is really more connected to how much money you have. The statistical probability of you getting what you want is a lot higher. There is a direct correlation between how much money you have and you getting what you want in your policies. There was a study published in Princeton more than 10 years ago, describing that and saying how more and more this society was becoming a plutocracy or an oligarchy and less of a democracy. And when you guys come up with your amazing research projects and your amazing initiatives to address urgent issues related to coastal resiliency and climate change, to improve the conditions for those coastal societies, we cannot show up with a rational construct in our head, thinking that this is just a rational process in which we're going to bring our research to policymakers, and then they're going to take that and they're going to do the right thing because we show them the evidence and that this is the problem and this is the solution, and then they're going to do it. Because these elected officials operate in a space, in a social structures of power and agendas that contradict, and they have their own interests, like being reelected, or sometimes being accountable to whoever paid for their campaign, but also they are accountable to their constituencies, and these constituencies have different interests. So that level of complexity requires that our complex to community engage, that level of complexity of the environment requires that we approach it with a complex mindset too, which I'm sure many of you do, and I would love to have a chance to learn and hear more of your specific, the many ways in which you successfully have pushed and moved policy changes for coastal resiliency. So I'm going to move faster so we get a moment to hear questions and comments. So just to end this part is that we need to be intentional and clear about our theory of change. You have frameworks and theories to explain and understand the complexity of the ocean and its interaction with coastal geographies and communities. You go deep into understanding the different factors. I will invite you and challenge you to also do the investment to work interdisciplinary, multidisciplinary, to make sure that your understanding of those communities and society also reflects the complexity of society, and avoid having a very rich epistemology and methodology and view of the biological, oceanographic, and natural aspect of life, and then maybe a very mechanical understanding of society and institutions. And I'm not saying that that's what you have. I'm saying that that's what I have seen sometimes from researchers coming to bring their research to community and showing a lack of understanding of the complexity and the positionality of the community partners they are inviting. For instance, when I invite someone from the community to come to an event when I'm going to make a presentation about my research, in the context of here, Texas, and in general, the US these days, I'm asking those people to take a risk. If they are immigrants, even if they are, they have residency, or if they are naturalized citizens like me, or if they are undocumented, I am asking them to take a risk to get out of their house and come to a meeting on the way there, they can be stopped by the police and arrested and sent to a detention center and deported. So when I invite someone to come and show up to a meeting to share knowledge and information for a shared goal, the first thing I need to do is to honor their presence and the effort and the risk and the conditions in which they are doing that. If it's a working class woman, who knows what extra work they have to do to leave the house ready, dinner or fixing childcare. If they are, again, immigrants or refugees, and we are operating in the language that is not their first language, they are making an effort to understand a second language. They maybe took public transportation. So honoring the effort and the presence of people is essential to what we do. And looking at the multi-layer reality, like how can we look at the different conditions, like the personal, the family, the community level, and then when you're bringing policy research proposals that you want to turn into policy, you need to work in alliance, again, within this context of society and structure. So how can our research and education and policy efforts navigate these complexities? Well, it starts by recognizing them, by reorganizing our cognition to see that complexity and not reproducing simplistic explanation of society, and understanding that power is essential to the way we look at the articulation of society. It helps also to reflect on the way that needs, values, capacities, opportunities, and history play a role in how people engage with our initiatives. I know that sometimes we organize an event and people don't show up, and it's a very human and natural reaction sometimes to blame people and say, like, they are not interested, they don't care, they don't understand. That's a natural reaction, especially if I get pressure from my institution, if I am an early career professional, if I'm a graduate student, I get pressure from the principal investigator in my project or from my boss to show the numbers that people are coming, because we have grants and we have deliverables, and we say we were going to train this many people on this specific aspect of our research, and we don't have the numbers to show. That puts pressure on us. But we need to resist the temptation of blaming people for not showing up, for not engaging, because usually it's not, first, we should not be blaming. It's more like, let's understand. And understanding, let's understand the barriers people are facing to participate. And in my experience, when I have organized things and nobody shows up, and it has happened many times, it's because I had a lack of knowledge and understanding of the context I was operating in. Why that wasn't a good place or a good time or a good day to create to have an event. So engaging in dialogue with people is essential. And in doing this, we need to acknowledge and honor the fact that many of the people we're trying to engage are navigating everyday life in this suffering between, and this path between suffering and hope. People are facing illness at home, and again, sometimes poverty, lack of access to services, abuse, fear, and we are inviting them to engage in something. So we don't have to solve it, but we can acknowledge and honor that. I would like to, again, it's a webinar, but I would like to see if we can take a moment for you to share in the questions some challenges, some barriers that you have found for community engagement, and some practices that help remove them. And we don't have the chat function, but we can do that on the question function. Okay, I'm going to stop sharing for a moment so I can look at the questions.
In the meantime that we are waiting for people to start writing on the chat, I would like to say something, like to answer to your request from my personal perspective. You've been talking about the pressure that we get from institutions about deliver our outcomes in the form of figures, about participation and engagement. I see that we also get a lot of pressure speaking of time. So very often community engagement is seen as time consuming. So I want to ask you if you have any suggestion on how to balance the need for inclusiveness and the pressure of deliver fast results.
Yes, I thank you, Annalisa. The very good question. We have deliverables in our grants, and that makes things a lot harder. And again, just to acknowledge that, and that have a sense of compassion, that sometimes we are being put in conditions to do like what looks like an impossible thing. So one of them will be to ask not just what is my research question, but what it is that I am trying to build, center on building relationships. And instead of just thinking in terms of events, think in terms of process. So it's how I'm gonna engage in a relationship with this community group of these stakeholders, small business, elected officials, in a way that is not just this event to present the research outcomes and the idea of the solutions, but like how ideally I want to get support from my institutions and my team to stay in relationship with this group over time, and how we're going to be building trust and engagement, building even solidarity and collaboration, how that looks over time. And not only for this specific project, but beyond the project. I am creating the conditions to stay in good relationship after this project, so that next time I come back with another research project, another research finding, and I'm gonna not only invite people to measure, take pictures of the coastal erosion and see who can engage, or help me put some things to measure the temperature on the water, but now in next year I come with a research project to see how can do some mitigation intervention, that we're going to have an existing relationship of trust and collaboration. So don't just think on the event and think on the relationship. Do not just think on what I want to measure, but what I want to build. And here at the last one, I have this 10 points, and I left the last one open for people to add their own, but it's the notion that we need to acknowledge the difference between knowledge and acknowledgement. That was very repetitive, but yeah, we'll be mindful of the acknowledge people, conditions, and reality with respect. That opens the door for a different kind of relationships. Acknowledge people's wisdom and experience and profound understanding of their own environment, and be on genuine dialogue, be open to modify my what I think I know, and how to navigate the complexities, understand the risk, use participatory ways, and also acknowledge that there is a navigation of actual power, and how can I be an ally for people's survival, not just my project, but if I can be a connection to other institutions that might help them in their survival. So again, it's an ethical question of once we're interacting with community, and particularly with marginalized communities, how can I be relevant to their own interests and agenda, and not just make them functional to my own research or policy interest, but actually this different kind of engagement. No, I see we are on time. And Marvin shared a couple of comments there. Some of the variances in difference and cynicism that these researches and studies were used an exposition for someone who wants to progress scholastically with those research and studies will not be of use tangibly. Solution: after conducting research and study, go back to the community and inform them of our results and how these research and studies can help them and can be further evaluated and monitored. Research needs to engage continually and grow with the community and empowering. Yes, thank you, Marvin. And I will say that yes, and also it's not just after, but during is how can I bring resources to the community itself? How can I do? Can I share stipends? Can I share some access to actual resources for the people who put time into the collaboration? Francesca, it's involving college is a question of time, recognition, and language. To involve citizens is a question of language, scheduling, and create trust. And stakeholders, language, participatory activities, common goals. Yes, and by language, it's a language that is relevant to people's experiences. Sometimes you hear the expression, we need to lower the language, the scientific language, to people's language, and that implies a hierarchy. And all languages, as human creations, have the same level of sophistication. They are just codified differently. So it's not an issue of level, it's an issue of relevance. How can I speak a language that is relevant to your wisdom and experience and knowledge? And to do that, I need to spend more time there learning. So showing up not as an expert, but as a learner goes a long, long way. So I know we're on time. I wish we could camp here and stay for a longer time. Do we have 7
we
minutes?
have just another question.
Oh.
There is a little bit up by anonymous attendee.
Yes.
Not a question, actually, a comment.
Barriers, community engagement. Sometimes there is prior engagement by other scientists has been extractive, the trust felt. Yes, thank you. Sometimes you show up and the environment is polluted by disrespectful and abusive and extractive situations. I have to say that one, and I'm going to close with this, like how to overcome is longer community engagement, immersions, learn to live their lives and trust building. Again, yes, be open to their humanity, humanize the space, like Alejandro was telling us. Don't be alienating people. And yeah, how can we be in solidarity? And that's the last thing I will say. Oppression can be accidental. I can be something that hurts you or marginalizes you or excludes you by accident, and it's structural. Solidarity is always intentional. So make sure that you take time to be connected to your values and intentions so that you can be intentional in your solidarity with that community that you are working with, especially with those who are more marginalized. And that goes a long way into building trust because trust is based on experience. So deep breaths. I was rushing over this. I hope it was helpful and made sense. I, again, would love to be in the same room with you all in each other's presence and learn from what you do, the important work you're doing in your conditions, in your context, facing a challenging historical times. So I leave you saying thank you for the work you do and inviting you to make sure that in the busy work you do, you take time to connect to your roots, to what makes you strong, to what gives sense to things. Don't get lost in the how and forget the why and what for.